So moving on to chapter 20, these are all of the gram-negative bacilli. I will start off by going through the non-enterics and then I will transition into the enteric bacteria. So there's a table located here on the right where you could see all of the different genera that we will be covering. And the only one that I will not talk about actually is the bacteroids, which are not responsible for causing disease. And actually, generally, most within this grouping are not medically important, but I will cover the ones that can cause infectious disease. So some are true pathogens, they will cause infection in a healthy individual, and then some are responsible for an opportunistic infection. Please remember that because these are gram-negative bacilli, they are associated with the formation of an endotoxin from the LPS, the lipopolysaccharide within the cell wall. Now, for the aerobic gram-negative non-enteric bacilli, first genus I will cover is Pseudomonas. Second group here, Brucella and Francisella. These are both zoonotic pathogens. And then third on the list, Bordetella and Legionella. And I will talk about the diseases associated with those two genera of bacteria. So for Pseudomonas, these are generally smaller bacteria with a single polar flagellum. They have been found to possess the ability to break down, for example, a toxic oil spill, so they have bioremediator potential. And it seems that they are frequent contaminants in homes and also in the hospital environment. And classically, one of their characteristics here is they have the potential to produce water-soluble pigment. So this pyocyanin is one pigment that they can produce. Now, it seems that a lot of Pseudomonas bacteria, in particular, Pseudomonas aeruginosa, is commonly found within soil environments and water, and it's actually a normal resident microbe within 10% of individuals in the intestinal tract. And it seems to be a frequent contaminant in the medical healthcare world of ventilators, IV solutions, and also anesthesia equipment. So this is one that's associated with causing opportunistic infections. And we do see higher levels of antibiotic resistance associated with this particular species. Now, the types of infections that this microbe can cause generally are pneumonia, urinary tract infections, and infections of an open wound, earaches, even eye infections. Also, we've seen cases of heart or meningitis, and a lot of times these opportunistic infections are found in cases where individuals have suffered burns or chronic diseases like cancer or even cystic fibrosis. And this particular species, so I mentioned before that they can produce water-soluble pigments. For aeruginosa, it's this pyocyanin. And again, we're seeing a lot of antibiotic resistance associated with this opportunistic microbe. Now moving on to Brucella. So there's two species that you should remember, Brucella abortus and Brucella suis, so associated with cattle and pigs. And typically this bacteria is transmitted to humans from contact with infected farm animals. And it can cause this fluctuating pattern of fever that can last anywhere from weeks to a year. So there are some other names that you might read or hear associated with Brucella infection, like Malta fever, undulant fever, also Bang's disease. And this is a zoonotic pathogen, so it is transmitted from animals. And as far as treatment, tetracycline, rifampin, or streptomycin, there is an animal vaccine available. And as I mentioned before, Brucella and Francisella have been touted as one of the potential bioweapons, specifically if this were able to be aerosolized. Now, there is a unique test that I would like you all to remember to screen for the presence of the antibody for Brucella bacteria. So this is referred to as an agglutination titer test. And if you take a look on the right-hand picture here, this is what we call a 96 well plate. So it's basically this plastic plate that has 96 wells in it. And wherever you see this pellet at the bottom would indicate a negative reaction. So in the case of the pellet, what's happening here is that the antibody does not react and the antigen will pellet to the bottom of the well. In the case where you see that it's dispersed throughout the well, that would mean that the serum contains antibodies specific to this genus of bacteria. It's interacting with the antigen and it's dispersing throughout the well. So again, agglutination titer test for brucellosis, pellet equals a negative result. If you don't see the pellet, that is a positive result. Now moving on to Francisella tularensis. This is the causative agent of tularemia. This is again another zoonotic disease. And we see a lot of cases of this in the northern hemisphere, particularly associated with rabbits. So again, it's transmission by contact with infected animals, although we've also seen cases with water, dust, or even vectors, so insect bites. And one of the characteristic telltale signs of this infection is this ulcerative wound at the bite site. There is a 10% death rate in systemic and pulmonic forms, and this is another one that could be potentially used as a bioterror weapon if it was aerosolized. There is a vaccine, and we do have a couple lines of antibiotics to treat this infection. And then we have Bordetella pertussis, which is the causative agent of whooping cough, which is seen primarily in young children. And it's worthy to note that this is associated with often severe life-threatening complications in babies. As far as the transmission route, it's through direct contact or inhalation of aerosols. Now, the virulence factors associated with Bordetella pertussis are receptors that can recognize and bind to the ciliated respiratory epithelial cells. And because of this, also because of the release of toxins that will destroy these cells, this causes a loss of the ciliary mechanism and as a result will lead to the buildup of mucus and blockage of the airways. So literally people who are infected with this have trouble breathing and is most severe in very young children. In babies, it can kill them. There is a vaccine available, DTaP, which contains toxoid and other antigens for other infectious diseases. Now we also have alkalogenes, faecalis. So this is another one that's occasionally associated with opportunistic infections and actually may become a normal microbe. Now on to Legionella. So Legionella pneumophila is the causative agent of legionellosis. And this is one that we see that has this symbiotic relationship with a protozoan. So it lives in close associations with amoebas and is found in water. It has notoriously been spoken about with regards to this 1976 epidemic of pneumonia caused from Legionella, which afflicted 200 American Legion members and killed 29. So this is the causative agent of legionellosis or Legionnaire's disease and also Pontiac fever. And we see majority of cases prevalent in males over 50, also in elderly patients in the hospital. And as far as symptoms, fever, cough, diarrhea, abdominal pain, and there's a 3 to 30% fatality rate. There is an antibiotic, azithromycin, available for treatment. Now on to the enterics. So these guys generally are found living in the soil, also water, decaying matter, and are very common occupants of the intestines of animals, including us. They are the most frequent cause of diarrhea through the release of these enterotoxins. And the enterics, along with the non-enteric gram-negative Bacillus pseudomonas, account for almost half of all hospital-acquired infections. So it is worthy to note here within the enterics, they're divided up into two groups. So one group is the lactose fermenter group, and these would be called the coliforms. Also, we have the non-coliforms, which are the non-lactose fermenters. All of them can ferment glucose, also take nitrates and reduce them to nitrites, and they have catalase as an enzyme part of their peroxidase system. Usually we have to use enriched media or even different types of selective and differential for screening certain patient or animal samples for pathogens, or even testing water for coliforms. So I will talk about a lot of these that you see on the list here. And as far as the enteric genre, again, just remember that you can divide them up here. The first distinction would be via its ability to ferment lactose, right? So you can set up this test on triple sugar iron media, and if you have a positive result, you know it's a coliform. Negative result, it would be a non-coliform. And then all of these other biochemical tests could further break down exactly what we actually have in our hands, according to whether or not they are either motile or they can metabolize all of these substrates here, for example, hydrogen sulfide or citrate. Now, because we're mentioning enterics, I would like to introduce this EnteroTube, which is a method for rapid biochemical testing of these bacteria. So literally this is just one tube that has all of these different tests. So if you look on the top, all of these are the substrates that are found within each well here. And the way that this works is one of the ends of this you can actually unscrew, and it's connected to a long sterile wire. And the wire actually is spanning throughout the whole length of this tube. So you would unscrew this, pull it out, and pick up whatever your unknown bacteria is from the sample that you have. So pick up some of that bacteria and then basically introduce the bacteria by stabbing the tube through the whole length here. And as you're doing that, you're introducing the bacteria into each one of these wells. And you would let it incubate for about a day, and then you would check the results. So basically on the top, you see the colors of the wells prior to inoculation, so uninoculated. And this EnteroTube is a colorimetric test. So basically, if there's a positive result, the well will change color. So that's how you can tell right away. If it doesn't change color, then you know that it's a negative result. So this can be used to essentially figure out what bacterium that you have in your hands. When you actually look at the results, you come up with, similar to a barcode, a specific number that then you can refer to a pamphlet that will actually tell you exactly what you're working with. Now, I'd like to bring up the concept of virulence factors that contribute to disease. So I think that we have mentioned this a little bit before, but I wanted to go into more detail as far as the naming of specific bacterial species. So I think in week 1, I brought up this strain of E. coli, and I called it E. coli O157H7. So what did the O and the H stand for? So specific namings of unique strains of bacteria may contain either an H, a K, an O in the name, and these are referring to the different virulence factors that have been found to be associated with that pathogen. So the H is referring to the flagellar antigen, so this is the flagella, right? The K would be referring to the capsule, so flagella on the bottom, capsule on the top would be K. Or the O, which would be the cell wall antigen. So all of these are considered virulence factors, along with toxins, so endotoxin or exotoxin. Remember, the endotoxin is found in the gram-negative bacteria. And also, along with all of these, we have enzymes. So specific enzymes associated with staph, like exfoliative toxin, or with strep bacteria, coagulase, right? Especially in Staph aureus or DNase, streptokinase, and strep bacteria. So all of those enzymes are also considered virulence factors. All right, so moving on to E. coli. So this is one of the first enteric bacteria that I'm introducing. So within E. coli, there's actually 150 different strains of this particular genus species. Some have developed virulence through plasmid transfer, so through bacterial conjugation, where they're swapping DNA through the pilus. And remember, it's only gram-negative bacteria that have that pilus. Some are also associated with opportunistic infection. So they're both causative agents of true pathogenic infections and also opportunistic infections. Now, there are different labels here for the disease-causing pathogenic strains of E. coli: enterotoxigenic, enteroinvasive, enteropathogenic, and enterohemorrhagic. So this one, the O157H7 strain, this is the one that causes the most severe case of disease. It can cause a hemorrhagic syndrome and also associated kidney damage. All of these are generally associated with GI-related illness. So enteropathogenic, linked to wasting from infantile diarrhea, enteroinvasive, inflammatory disease of the large intestine, and then enterotoxigenic. This is one that will release a toxin that will stimulate fluid loss, and it also has Fimbriae as well that can aid in its ability to attach to the digestive tract and facilitate the inflammatory response. Now, across the board here, E. coli causes 70% of cases of traveler's diarrhea and 50 to 80% of all urinary tract infections, and actually is associated with the greatest cause of mortality among babies. Now, this is one that generally is screened for in water safety tests. Because of the fact that this is associated with fecal contamination, it is considered a coliform, so it does ferment lactose. So this coliform count is done. This serves as an indicator of fecal contamination in water. Now, another opportunistic coliform enteric bacteria is Klebsiella pneumoniae. So generally it has this pink hue to it growing on an agar plate. It is normally found in the respiratory system and has this slimy outer coating, this large capsule. And it is a causative agent of hospital-acquired pneumonia, meningitis, bacteremia, also wound infections, and even UTIs. We also have a few other opportunistic bacteria, which are coliforms, gram-negative, Enterobacter, UTIs as well, and wounds, Citrobacter, and this would be opportunistic UTIs and sepsis. And then also the Serratia marcescens, which has this characteristic red pigment grown on agar, causes pneumonia, also burn and wound infections, blood infection, and also meningitis. So those were the coliform enteric. Now the non-coliform lactose negative enteric, which would be Proteus, Salmonella, and Shigella. So Proteus is another one that's associated with a lot of opportunistic infections. Normally it's harmless. And you can tell that you have Proteus because of the macroscopic observation, the way that it grows on a colony, in a colony formation on an agar plate, is in the shape of this concentric pattern. So it's a swarm on the surface of moist agar in this concentric pattern, and it's involved in urinary tract infections, wound infections, pneumonia, blood, and also infant diarrhea cases. Now, we have Salmonella and Shigella, which both can cause gastrointestinal involvement in diarrhea, but often affect other systems. So there are a few species of Salmonella to bring up here. Salmonella typhi causes the most dangerous form of any disease in the Salmonella genus. So this causes typhoid fever. It has a human host. And I believe you guys have watched Typhoid Mary, about the characteristic case of a chronic carrier or healthy carrier of Salmonella typhi bacteria. So she was a cook working for wealthy families many years ago. So this is a true documented case of a healthy carrier. And she would go to the bathroom, get the Salmonella bacteria on her hands, not wash her hands, and then handle people's food. And when they were eating the food that she had prepared, they would contract typhoid fever. So it was this huge public health concern many years ago. Also, other than typhi, Salmonella cholerae suis, this is a zoonotic associated species of swine. And then enteritis, this is probably the one that you've heard of more commonly. So Salmonella food poisoning is caused by enteritis species. So this includes 1,700 different serotypes based on the O's, H's, and V's, which also are K's. But remember back, these are the antigens. And generally, a lot of these bacteria are resistant to chemicals and also can survive for some time outside of the host. Now, in the case of typhoid fever, so the bacillus will enter via ingestion of fecally contaminated food or water, and also there have been cases where it's been spread by close personal contact. The bacilli will adhere to the small intestine, cause invasive diarrhea that can lead to blood infection. There are 2 vaccines available and also some heavy-duty antibiotics, so sulfa drugs and also chloramphenicol. Now, as far as Salmonella enteritis, again, this is associated with food poisoning. They're all zoonotic in origin, but humans can become carriers. So this would be from cattle, poultry, rodents, reptiles, animal and dairy products, and then also even fomites or inanimate objects contaminated with animal intestinal flora. And usually these cases are way less severe than typhoid fever, but there's more of Salmonella food poisoning. And this also can be referred to as an enteric fever. Now we have another bacterium here that is the non-coliform gram-negative, so Shigella. Shigella is responsible for causing shigellosis. This is incapacitating dysentery. And species here, Dysenteriae, Salinae, Flexnerae, Boydii. And all of these will invade the large intestine. They will enter the Peyer's patches and release toxins, so endotoxin, exotoxin. Usually people who are infected require oral rehydration therapy, fluid replacement, and then similar antibiotic, sulfa drug, and Cipro can be used to treat these infections. Now another gram-negative bacilli here, non-enteric, Yersinia pestis. So Yersinia pestis is the causative agent of the bubonic plague. And I would remember there are a few different virulence factors associated with this microbe. So this enzyme coagulase, endotoxin, and also murine toxin. And so these particular virulence factors will aid in protecting against phagocytosis and allow for the cell to grow at a high rate. Now, Yersinia pestis is contracted through contact with wild animals. So in this case, it would be called the salvatic plague, or domestic or semi-domestic animals, urban plague. And there's also pneumonic plague, which is spread from human to human. This particular bacterium has been found in approximately 200 species of different mammals. So rodents without causing disease. And it is one that notoriously in the bubonic plague that wiped out a good majority of the population many years ago was spread via the flea. So the flea harbored this bacteria. The bacteria was replicating in the flea gut. The release of the enzyme coagulase, one of the virulence factors, caused blood clotting that blocked the esophagus, and the flea would then become ravenous. So as far as the life cycle of Yersinia pestis, again, it involves potentially arthropod, the flea vectors, also all of these different species of mammals, remember around 200. And different forms depending upon which animal is spreading it. And then in the case of pneumonic plague, this is where it's spread from human to human. Human to human transmission is less common, so that is worthy to note. So humans in this case are actually the accidental hosts. Now, as far as a little bit about the pathology of the bubonic plague or plague caused by Yersinia pestis, in the case of bubonic, you see the formation of a bubo or a bubo in the groin or the axilla. So once the flea bites you, the bacteria will multiply within that bite, enter the lymphatic system, causing cell death or tissue death and swelling. Also, in the case of septicemic, so this would be throughout the blood, the virulence factors cause coagulation, and if you've heard of another common name, the Black Plague, so this is from a blood infection of Yersinia pestis that causes subcutaneous hemorrhaging. And then we have pneumonic, again, human to human. This is an infection localized to the lungs, highly contagious, and is fatal without treatment. Now, as far as treatment, we do have antibiotics, streptomycin, tetracycline, or chloramphenicol. There actually is a vaccine available. And as far as controlling it, preventing by quarantine people who are infected, and also controlling the rodent population. And then we have a few oxidase positive non-enteric pathogens. So actually all of these are within the Haemophilus genus. So Influenzae aegyptius and Ducrae. Haemophilus, all of these species here, some are found actually in the upper respiratory tract or the vagina, so Parainfluenzae or Ducrae, and they require special growth requirements. So none can grow on blood agar without these special techniques and also these cofactors added. So other than being normal colonists, some can cause disease. So the ones that can cause disease, influenzae, can cause meningitis, epiglottitis, which can be very serious, ear infections, sinusitis, pneumonia, also bronchitis, and there is a vaccine available. And then we have Aegyptius, which causes pink eye, and also Ducrae, which causes a chancroid STD. So those are all of the pathogens that you are required to know for Chapter 20. I will see you guys in a few days for next week's discussion. Take care.